Hello, my name is Brooke Alexandra, and I'm here today with my co-author, Dr. Lindsey Brandt, and we are here to just have a little bit of a conversation. It's our 5-year anniversary of the creation of the Comprehensive Teacher Training Program at Reforming Foundation School of Pilates. So we're just gonna have a little conversation about why we created it, why we think everybody ought to take it, and what we're passionate about. So 5 years, can you believe it?
No, it's flown by, but also, wow.
Wow.
A lot's gone into it.
Yeah, I feel like we kind of had a baby together. We birthed this giant school.
Yeah.
We now are almost on 50 graduates of this school.
Yeah.
I mean, we set out on this goal, so a little backstory, and I'll just share, so that people can get to know us a little bit better and our why and why we're here and why we're so deeply passionate about turning this school into a global program. So a little bit of my backstory. I came to Pilates, if you remember, as a person who needed to rehab their body and was constantly getting injured. I was an athlete, I was a gymnast, I ran track, I did all these things. And as a young adult, just constantly getting injured with different forms of fitness and exercise and personal trainers. And Pilates became this thing that I just felt at home in my body. But that was after a significant injury. And so when we think about Pilates as a form of exercise, and you as a doctor of physical therapy and treating patients, you've seen injuries from Pilates too.
Absolutely, yeah. I mean, one of the driving reasons behind me saying yes so quickly to your desire to build this program was really the challenge that I often had with my own patients, which was when they're done with care, they've met their physical therapy goals, their question for me was always, well, what now? What do I do next? Do I go to a personal trainer? Should I do yoga? Should I do Pilates? And then at the same time, I'm having other patients come to me who are being injured in those fitness settings. So I never had a good answer. I didn't have anyone that I felt I could trust in the fitness industry with my people, right? So someone comes to me, they're injured, I help rehab them, they reach their goals, and they become my person. And I didn't have anywhere that I felt comfortable recommending my people to go. And I felt that Pilates in general was valuable, and I found it myself also as a client recovering from my own injury. But as I moved into becoming certified in Pilates, I also found some sticky spots that made me concerned about injury potential in a variety of populations. So it was great to be able to take what exists in the Pilates industry and with you sort of examine and take everything apart and put it back together in a way that would be safer and more accessible.
Yeah, and it's an incredible thing that we've accomplished to be able to take this beautiful form of movement that Joseph Pilates created and really innovated from a start, from rehabbing people from injury and helping them. His whole point was to have everybody have a full requisite of beautiful health and wellness, like their whole body, mind, and spirit united together. And so with my Pilates experience and then your clinical, physical therapy background, it was just like this beautiful marriage of the skills and talent to be able to come together to produce this school that really focuses on setting a person up for success in their start position, right? If we don't get started right, it's going to break down.
Right.
And really, the students have really learned to start an exercise properly and then to learn how to tie biomechanical keys into the full movement potential so that now this full expression of this movement can be achieved in a much more accessible way. And so one of my injuries that I sustained that you've actually helped treat me with has led to this passion project of ours, because not only was it an injury that I sustained, but as a treating physical therapist, you saw it happen over and over again in our studios. And I didn't understand, how can people be hurting their backs doing Pilates? So can you say a little bit more about what we've been able to create within the teacher training program to help people with their spines?
Yeah, so one of the primary, the piece that I think you're most referring to is our material that teaches our trainees to respect the sciatic nerve, right? So we know that the sciatic nerve is the largest nerve in the body. It starts in the low back and it extends down the back of the thigh, behind the knee, it splits into branches and it goes all the way down to the toes. And low back pain is one of the primary reasons in the US that people seek physical therapy. So I have a lot of experience in managing low back pain that is related to nerve issues such as sciatica. And there are many shapes, one shape in particular in the Pilates repertoire that shows up over and over again that places a lot of tension on the sciatic nerve. It stretches it. And nerves are not made of material that responds well to stretching. So when we stretch it, it doesn't get as much oxygen. And if we stretch it over and over and over again, then maybe we start to diminish its function. Maybe we start to increase the likelihood that the patient's going to experience pain related to the sciatic nerve. And there are actually really simple ways to modify Pilates exercises to better respect the sciatic nerve, to reduce the likelihood that we're placing excessive tension repetitively during someone's Pilates practice. And so we teach trainees about that positioning that places tension on the nerve. We also teach the exercises in a way, so we've taken the Pilates exercises and we've made the little modifications necessary to—
Baby bit.
Yeah, just a little bit. It's not major.
Yeah.
And just that little bit of change retains the intent and the benefit of the exercise while making it safer for someone with a history of low back pain or for someone who's aging and is at risk for that type of condition.
Yeah, absolutely. And what we're seeing in the quality of trainees that we are producing, and I'm really just proud to say, we have trainees that are now owning and operating their own locations, several. We have trainees that have gone to join our team and believe in the vision, mission, and values that you and I are building here through this school, and they're supporting it. And then we have people who have just done it to learn how to move and feel safe in their own body from a same curious perspective that I first started my Pilates journey on, just as a human trying to learn how to move better and feel at home in my own body. And so this comprehensive school has produced all three of these things, and we're wholeheartedly supportive of each of these demographics that love the school. But one of the things I wanted to talk a little bit more about is that, with training trainees to think critically, be able to think from this biomechanical key perspective. So it's not like the human body is not cookie cutter at all. It doesn't just follow a recipe and everybody's body does X, Y, and Z like textbooks say they ought to, right?
In theory, that's the way it all happens.
But
when you actually work with a human being, you know that theory kind of goes out the window.
yeah. And so really teaching them to have strategies and to be able to pull from their toolbox. And then we've also had many different type of trainees that have come into the school with varying different experience levels. So we've had people start who've never done Pilates before.
Yeah, that's wild.
It's wild. They're doing it.
Yeah.
It's been a journey, but it's hard work. So, they're doing it.
Ultimately, they've succeeded.
They have, and they've learned how to do it properly. So what's been magical about that is there wasn't movement patterns that we had to necessarily repattern because we were able to teach them how to do it properly. And then one of the things I was thinking about too is just the physical therapists, the occupational therapists, the massage therapists, the personal trainers,
Mental health professionals.
Yes. Like the type of people that are coming to our school are really hungry for knowledge and for growth and have an open mind to be able to learn new content and incorporate it into their existing careers.
Yeah, it's really cool to see.
Yeah, and then the other thing I was thinking about too, and I'd love your opinion a little bit more on, is as we talk about the sciatic nerve considerations, we're very open-minded also. There are some populations. We have professional athletes, we have dancers, we have people who have to make crazy shapes with their bodies to do the thing that they need to do. Yeah. And so can you say a little bit more about how we equip our trainees to use judgment skills in those environments?
Yeah, so, just as you said, the body's not a cookie cutter. Everyone has different abilities. Everyone also comes with different goals and different needs, different things that they need to do with their body on a daily basis, whether that is to take care of themselves and their family and their household, or to be out earning a living as you said, a professional athlete, a professional dancer, who sometimes need these extreme positions of their body. And so we aim not to instill, we don't want to come from a place of fear of any position in the body, but we want our trainees to be making critical choices about, does this person need this movement pattern in their body to be successful in the things that they need and want to do on a daily basis? And then, how do you balance that need or want of the client with your knowledge that we provide about the sciatic nerve and how you might best keep their nerve protected and safe? So we teach the trainees to balance pros and cons of different types of movement. We also teach the trainees to make judgments about when they should refer to an outside professional.
Yes.
So that's one of the other things that we really emphasize in this program, is that every movement professional has a scope of practice, and a Pilates instructor scope of practice may overlap at times with personal trainers and with exercise physiologists and with physical therapists. But Pilates instructors are not equipped to diagnose or treat. And so we teach the instructors, the trainees, how to identify when a client may need the advice of a professional, such as a physical therapist, to help guide their movement. And so we train them to recognize when they should refer out for that information. We also train them on how to actually follow the guidelines when they get them, which is where our anatomy comes in, right? So we teach, the program begins with an online anatomy course for Pilates instructors. So it's not high-level PhD anatomy, but it is the anatomy and the movement terminology necessary for our graduates to be able to communicate effectively with someone like a physical therapist and accept guidelines and ask questions in a way that ultimately gets the client what they need in their Pilates sessions.
Yeah, I'm so glad you brought that up. And it kind of makes me think a little bit more about that relationship. And this was something you and I had extensive conversations early on, because I took for granted. I have this, history or backstory of my former career being in dentistry. And because I was so well connected through my dental doc and all of his peers and his doctors, surgeons, physical therapists, I had all this access by text message to this wonderful group of humans as I was starting my new career in Pilates. And he was so supportive of it that he made these intros, and I had at my fingertips a physical therapist, a doctor, a surgeon, and I took that for granted. I thought everybody had that level of access.
Wouldn't that be nice?
Yeah, right. And so that was part of my motivation with asking you to help create this program, but also then to serve as a support within this community, so that Pilates instructors have an immediate resource. And it happens throughout the entire curriculum, where just through our community network, they can post a message, and we promise to be responsive within 24 hours to answer those questions. And, with all of your, higher knowledge in anatomy, where sometimes, I have my Pilates instructor anatomy background. I don't have that college degree in anatomy like you do. And so it's a phenomenal support tool to get the trainees access to those questions, but also, the physical therapists and the occupational therapists that come in with that, having that knowledge and then trying to do the math of the movement with the anatomy.
Yeah, and these trainees who come into our program are hungry for knowledge, and generally, I think Pilates instructors are part of a large group of professionals who really are helpers at their heart. They want to help people move better, and they always want to know more about why. And sometimes the question about why is this really tiny little detail that might not be included in the average knowledge base of any Pilates instructor, but yeah, it is nice to be able to be in a role where I can help to answer those questions and help the trainees and graduates through the alumni network to put those pieces together when necessary. And it also speaks to, you've mentioned a couple times, we have 50 plus certified currently.
Yes.
So 5 years ago when we started this program, it was like a hope and a dream for me to have fitness professionals that I could trust with my patients. And now I've got a network of 50 fitness professionals, and geographically it's broadening.
Yes.
Right? So yes, it's here, it's most dense here locally in southeastern Michigan and Metro Detroit, but we have people in northern Michigan, the northern lower peninsula. We have someone up in the upper peninsula. Now we have what? Indiana, Ohio, right? So we're expanding this network, but through the alumni connection, even though geographically they're not here, there's still that opportunity to continue to engage and interact with like-minded professionals who are curious and always hungry for more knowledge. So I think it's really great.
It is, and it's such a privilege to be part of it and to offer that level of support. It was something I was missing as a new graduate of my first teacher training program, was to be able to have continued mentorship and support. And so I love that we're offering that through the alumni community. I wanted to circle back a little bit more to some of the other differentiating factors because when we embarked on this journey, we sat down over many months of planning. And you asked me so many critical thinking questions about what did I feel as a studio owner was lacking when I hired somebody, and what were the skills that I needed to teach. I was finding I was constantly mentoring from graduates of other programs. And so we mapped out a few other things that differentiates our program. One of them is in class programming. And so can you say a little bit more about helping our trainees to be able to, because I mean, let's face it, there's tons of equipment, we have tons of toys, we have thousands of exercises really, and then all kinds of, I mean, Joe just engineered amazing equipment that you can be so creative with to create anything you want on these machines, right? So how have we designed, from your background at, teaching at Oakland University and being a professor and teaching new students and, brains to formulate plans, like how has that come and informed our curriculum for class programming?
Yeah, so I would say for the most part, class programming is really your baby, right? You're the one with all of that experience. I'm not a group class fitness instructor, I never have been, but by taking what I see you do and then talking with you about, why do you make this choice and why did you make that choice? What we really were able to do is drill down a formula or a template, so to speak, for our trainees to use, because one of the challenges with learning so many exercises, right?
Stacks.
Yeah, I mean, the manual stack is this tall.
Yeah.
Hundreds of exercises. When do you use them? What order do you put them in, right? Which pieces of equipment do you use in a class? How many pieces of equipment do you use, right? So you certainly can take the approach that the trainee should just play with it and figure it out. And that's fair, but that takes years and years, right? And lots of errors along the way. And so how can we reduce the number of errors that happen initially? How can we speed along that learning process a little bit? And one of the strategies for being able to do that is sort of giving people boxes, giving the learner boxes for where certain pieces of information need to go, right? So we start with, there's a recipe for programming a class, and that recipe includes a variety of, it's really 6 boxes that need to be checked in a certain order within a class. And then there's a whole weekend within the curriculum dedicated just to class programming, which from my understanding is not something that exists in any of the other programs that you've been exposed to.
No, yeah, I've comprehensively trained in 3, and I didn't learn that skill in any of my teacher training programs. So it was experience that taught, and then exactly like you said, trial and error. So yeah, teaching our trainees to have this framework, which also takes a lot of, like I remember doing my class program designs and spending hours programming, hours writing. And that was, when I first started teaching, there wasn't all this inspiration on Instagram. I don't even think Instagram was out. So,
right.
I didn't have that tool. I had to critically think, to plan, and I had to make mistakes and be like, well, that didn't land. People hated that. Oh, they loved this.
Well, even with the ideas that are out there on Instagram, you still have to know where to put them.
Yeah.
Right? You see a little reel of one new exercise, and that's great, but it still doesn't tell you where to put it in a class.
Right.
It still doesn't tell you which body or class level is most appropriate for that exercise, right? So you have to have the critical thinking piece of, why am I making this choice of exercise for this person or group of people? And then you have to have the template or the sequence around, how do I put it together in a way that makes sense, delivers a full body workout each time, moves the spine in all planes each time when it's appropriate for the client in front of me. So it was really, and the class programming comes fairly early in the program. It's the 4th weekend, right?
Yep.
So they've got enough exercises under their belt to have something to program with, but it's early versus at the very end, because they can be practicing with
Those
it
skills, yeah.
along the whole remaining 6-7 months they have in the program with the new exercises they're learning. So they have one template and then a variety of different ways to plug that in.
Yeah.
You know, and you talked during that class programming weekend about programming for different levels of classes, more the beginner level versus the intermediate level versus the more advanced level. But it's always the same sequence and template. It's just a matter of what do you put in.
Yeah, and I think one of the things that we've been really able, part of one of our values at Reforming Foundations is community, right? And kind of like I remember one of my very favorite Pilates experiences as a client before I was ever an instructor. I had a 74-year-old woman in my class who kicked my butt. I was 29 at the time. She kicked my butt week after week, and I was like, I want to be like her. I want to plank longer than she can plank, right? And so that was an inspiration for me in class. And so we have all age demographics. We have males, we have females, it's a very inclusive and community-based studio. And so teaching in that environment means our trainees need to have the skills to teach multi-level classes and to provide choices and safe options for people who come in with a knee replacement, a hip replacement, a shoulder thing, a neck thing, right? And so being able to look at pregnant, right? Being able to look at a list on a roster and then be able to make effective choices, but really on the spot, because somebody could sign up last minute for class.
You're right.
And your whole plan that you just planned the day before might go out the window.
Yeah.
And so I'm really proud of the result that now as a studio owner and hiring these trainees that we've been able to instill and produce in our trainees, in this environment to really make, one of my goals in starting Reforming Foundations was to make Pilates more accessible. There's still some room for improvement for that long-term goal, but it's happening, and we're doing that by making it more available to a wide variety of populations, which was one of the first things that we set out to do.
Yeah, absolutely. Yeah.
And so kind of like the next thing I was thinking we could share a little bit more about is really more your baby. So you talked about class programming being mine. Well, you have a few in the program. We've got the sciatic nerve, and then we also have, one of the things that I had shared with you when we were talking early on about pain points is I was trained to assess somebody's posture from a standing position, looking out them the front, side, back. And, that is an approach that many physical therapists use, many physicians use, right? But in my real world experience, what I found was that made people feel really uncomfortable and super judged. And often when I did that initial assessment on that first visit, they didn't come back. And so we started having, this was probably back in the day when you were a client, before we even authored this together, we started having conversations about better strategies so that I didn't lose clients. And those conversations led to this, and this has actually been an evolution through the teacher training process.
Yes.
Yeah, can you tell us a little bit more about that?
Yeah, so I just had the opportunity actually to teach some of that material this past weekend to our 5th group of trainees who are wrapping up. So the ability to watch a body in motion and make changes, make educated choices about how you can help improve the quality of their movement. So we talk a lot about matching client goals with safety in choosing the right programming for them. So we have to be able to deliver what they ask for, whether they're coming for more of a fitness-based Pilates experience, if it's a skill driven, they just want to get good at Pilates because they think it's really cool, or if it's someone who is coming out of a rehabilitation process and they want Pilates to help them prevent future injuries, which is actually well documented in the literature. So to be able to balance the client goals with safety considerations, and then also watching the client move and helping to optimize the way they move. And so we look at it from a couple of different perspectives. We look at it from the perspective of the first weekend or the first day of this sort of content is really around how can our trainees improve their verbal and tactile skills to help improve the way someone moves. But then when those verbal and tactile cues fail, sometimes it's because there's a lack of strength in a given area, or there's a lack of flexibility in a specific area. And you can have the greatest cues in the world, but if there's not adequate flexibility where it's necessary and strength where it's necessary, that movement that you're trying to teach is not possible for the client. And that's where I think a lot of trainees or a lot of practicing Pilates instructors, you've said it yourself, like you feel like you run into brick walls, right? Like, I taught it the right way, I demonstrated it the right way, I used all the hands-on techniques and cues that I know, and still they're not doing what I asked, right? Well, maybe they're not strong enough, maybe they're not flexible enough. And so this past weekend, I just taught the final day of the program where we look at some common Pilates exercises, and we really break down, okay, what are the common compensations in these exercises? Where do things go wrong? And what are the possible reasons? What might need to be a little stronger if someone's compensating constantly in a bridge? What might need to be a little bit more flexible if they're struggling with side splits on the reformer, right? So we look at specific Pilates exercises, what commonly goes wrong, and then we try to give possibilities, right? It's not always 100% of the time the reason, but we give some of the common possibilities, which then allows the trainees to look at the body in front of them and say, oh, I'm seeing this compensation and that compensation and that compensation. Maybe I need to focus on getting their glutes a little stronger. So it's been a really nice, and then we sort of finish that up with a case study activity where they have 4 different client profiles that are commonly seen in the Pilates setting, all with different goals, all with some different movement compensations that they're displaying in their first session. And then we ask them to program an individual session based upon the goals and the safety considerations and the movement compensations that they're seeing. And that really kind of carries into their final comprehensive testing. So beyond just teaching them the exercises, which is a feat in itself for them to learn, right? I think we have to give some credit to our trainees and what they're able to accomplish in a 9 or 10 month period. Just learning the exercises alone is a lot. And then they learn how to put them into a group class. And then they learn how to put them into an individual one-on-one session that really drills down a client's individual goals and helps them see progress toward those goals, which has been a really rewarding thing to be able to add into the program. And it existed in some form in the first year, but it really has evolved over these 5 years. And I think we both agree it's finally at the place where we want it to be, which is a good thing.
Yes, it is. I think it's a game changer. I mean, I commented to you just along the process how much even I learned, like diving in deeper, and like how much of a joy that has been to be able to co-create something and then still learn along the way.
Yes.
You know, it has been an incredible journey. And part of this goal that we have through this school is that we're creating more quality movement professionals, because just like Joseph Pilates, we want every human to feel this full, vibrant life. And when we can move with purpose, when we move with intention, we have a lot more power to our life and we feel a lot more capable. We're able to do all the things that we love to do. And I think, being a movement professional and helping people achieve those goals, it is such a satisfying career to be able to help, to be a healer, to be an educator, to be a mentor, to be a teacher, and help people find this deep connection to their body, but then also to their careers, right? And then to continue to support our students, our trainees as they graduate, through the alumni community. And, we just finished a 5-year strategy on all the content we have yet to build, and how exciting that is going to be to embark on that journey as well.
Yeah, and you mentioned all of the benefits that someone can gain from Pilates, and I think one of the things that's really great about it is that it's accessible across the lifespan.
Yes.
Right? So it's an exercise form that can be introduced in, elementary school or before, and it can be practiced really until the end of someone's life. I mean, what's the oldest client you've had?
Mr. Barbisack with, I probably shouldn't say his name, Dear John, our client John, who passed away at 99 with dementia. And it was such a fascinating thing. And I got to go to an Alzheimer's fundraiser event where I asked a PhD who's doing a lot of research, and she's talking about all the cures that are coming and how like in 5 years it's going to be a different state. I'm so excited. But I asked her this question. I said, John, he every time we did Pilates, it was his first time doing Pilates. Oh, we've never done this one before. But his body knew how to do it, and he executed those moves week after week.
Yeah.
And this person couldn't exactly explain, and I would love to continue to learn more about it. But yes, I mean,
there's so many populations that can benefit from Pilates. And as we age, right, one of the other things that we did with this program that was really one of my other babies is the neutral spine programming. So as we age, our discs in our spine degenerate, and they degenerate at a different pace for everyone, but it starts in our 30s. And so as I was working with patients with low back pain, you will find in the physical therapy literature that Pilates is very effective for helping to manage low back pain. However, there comes a point in the lifespan when there's a certain amount of degeneration or arthritis present in the spine where repetitive motions in certain directions for purposes of exercise are really not beneficial and actually are more likely to flare up symptoms for someone with a chronic spinal condition. So what we injected into this program is the ability of our trainees and our graduates to program a 50-minute session, whether it's a group class or a one-on-one session, where the spine stays stable in its neutral, natural curves throughout, but the body still gets trained, upper body, lower body, core. So it's a very effective workout for someone who is either recovering from a spinal injury and will eventually be able to move their spine again, or someone who is later on in life and has some significant degenerative changes and really will benefit from Pilates in a variety of ways, but there are certain ways they should just not move their spine if they want to manage their symptoms and keep themselves feeling good, which is ultimately what we're trying to promote with Pilates, right? Is longevity and movement quality and movement ability. So there are many exercises in the Pilates repertoire that can be modified or were created with no spinal motion. And so we make sure that our trainees know how to program in a way, again, making it more accessible to a wider number, because those were some of the challenges that I was finding when I started suggesting Pilates for some of my patients with low back pain, is that depending upon which instructor they found, sometimes it was great, and sometimes they ended up flared up. And so my hope is that this neutral spine aspect of the programming allows Pilates to be accessible to clients sooner in their recovery process and reduces the likelihood that they will have a setback as a result of spinal motion that happens during Pilates.
Yeah, and we're seeing proof of it inside the walls here of Reforming Foundations, and the incidences of spinal injuries reduced.
Right. Well, and that really came out of our work together with real people, right? Like, we didn't just decide that we were going to write a program together. We actually started by managing patients and clients together. Brooke would send someone to me and, hey, I don't know what's going on. Can you help? I would manage from the PT perspective and then give her some guidelines. And we were finding that the guidelines were always keep the spine neutral for 4 to 6 weeks. Keep the spine neutral for 4 to 6 weeks. And then I had to scratch my brain and go, okay, now what? Pilates moves the spine like a slinky.
Yeah. So how do I engineer all these different exercises? I just had a new client this week, actually, who young, like late 20s, early 30s, CrossFitter, her doing fitness, and was shocked because super strong human, right? But and they did not yet seek physical therapy. We'll see how we go, but they were shocked at how much of an effective workout Pilates was able to provide while not moving their spine, and how challenging and strong it was. So we've spent a long time here talking about the injury prevention and the educational component, and why moving with intention and purpose is so important to neuromuscular reprogramming and pain control and all of these things. But yet also Pilates is a phenomenal, lack of a better word, butt kicking at the same time. It's a total body workout every single time. And so while it can be therapeutic, it can also be incredibly strength focused as well.
Well, and so we talked about it being accessible across the lifespan. It's also accessible across the span of abilities.
Yes.
Right? So maybe someone starts as in a place where they're needing more recovery, but then once they're strong and capable, you don't just go send them elsewhere. Like, you just keep making their Pilates harder. Yeah. And there's infinite opportunities for that. Yeah. And that's also the nice thing about this program, is that it spans that level, different levels of ability of the client. So from the person who is quite weak, debilitated, just coming out of a rehab or health, issue, versus the person who's already quite strong and capable and wants the benefits of Pilates around body awareness and movement control and really deep core strengthening, which is something that I don't think many people experience before they actually do Pilates, and do Pilates in a very specific way.
Right. Yeah, 100%. It was fascinating. So also part of the demographic that has chosen to take the teacher training program are already certified Pilates instructors who are seeking more, right? They had the similar challenges that I had as a Pilates instructor, like scratching my head, making phone calls going, why? I did it perfect, why? Right? And so our education director, Barb, who is comprehensively trained in 3 programs as well, has sat through our program twice and is now an educator of it. She just got to sit through another section helping us create more educators, right? And so she was now auditing the new instructors, and she came back and she's like, I want to take this program all over again. Like, I'm so, like, every time I sit here, I learn more. And I think that's just the beauty of the way that the curriculum is written, with just layers for every level of learner. And, obviously our alumni can come back anytime and check it out and continue to learn more.
We do learn in layers. There's no way that you can absorb every detail of this volume of information with one pass. And so our educators are learning in layers as they teach the trainees, right? So, and also our trainees, our graduates are all continuing to learn in layers as they use the material. And then they realize they hit a roadblock and they're like, oh, I better go back to my manual. So there are aspects of the manuals that are meant for the novice beginner who's just trying to understand what the movement is. And then there are areas of the manual that are really more directed toward the higher level skill of watching the body in motion, critically thinking about what might need to be stronger, what might need to be more flexible. We don't expect our trainees to learn that all in one sitting. We develop the manuals in a way that they will be a reference for them throughout their career, so that they can always come back and find the next layer.
Yeah.
Which is, I think, really exciting and it will be interesting to see what the future brings.
Well said. Yeah. Well, as we wrap up a little bit, can you think of anything else? I think we've done a really great job of saying a little bit about why we're so passionate about this school of Pilates and our goals behind it. There are so many different curriculums out there to choose from, and maybe from your perspective, why should people choose us?
I think obviously we've said a lot about what makes the program different and special compared with other programs just from a content and curriculum perspective. But the piece that we really haven't touched on is the support in the community around the trainees, right? So community is one of the core values of your company. And it is not an environment where we're trying to eliminate or weed out or make people feel less than. It's really an environment and a curriculum that was built to support the learner and to build content in a way that allows them to be successful, challenged, but successful. And so there are things in place like the online community that's available basically 24/7, and what one business day turnaround on a response from the education team in terms of questions that are coming up while the trainees are studying. And also just every trainee is assigned a one-on-one mentor. Well, maybe not one-on-one, right? The mentor has multiple trainees that they're helping to mentor. But everyone has a mentor that they can go to with more challenging questions that need to be addressed outside of just like a hey, quick message in the message board community. So there's just constant support. There's a variety of digital and print learning materials, in addition to just the supportive educational community that is, and even the testing process. The testing process is not built to trick the trainees. Like, the testing process is built to allow the trainees to demonstrate what they've learned. And if you come in and you demonstrate what you've learned, then guess what? You get certified. So it's not about being tricky or gotchas, or it's really about support.
Yeah, well said.
Yeah. How about you? Anything else on your mind that you think we...
I think we've really well covered it, from just being able to sit down and critically think about what it takes to create an awesome movement professional, teach in layers, learn in layers, and given time to absorb. Also, we're very passionate and strict. Some people don't love it so much, but we start with movement foundations. And so these are pre-Pilates exercises that are not found anywhere. And how do you do these movement foundations? But we give the body time to respond and get stronger with these movement foundations before we go in. And so the program is also meant and given time for the student's body to absorb the work themselves and to be able to progress, because by the time we get to the last weekend of reformer and chair, like, we're doing some really hard athletic Pilates, right? And so we want our trainees to be able to have access to that movement potential. And so we are kind of guardsmen a little bit over, you've got to do these movement foundations. You've got to get this in your body. You need to learn how to activate your core and protect your spine. And then we're going hard.
Well, and then when you do the hard exercise and it breaks down and you can't get it, what do you go back to? You go back to your movement foundations. You go back to what is the part of the exercise that went wrong, and which movement foundation can I use to help train that piece of the exercise, and then put it all back together for the client.
Yeah, and it's a phenomenal learning opportunity right then and there. Yeah. Well, thank you so much for having this conversation with me today.
Absolutely.
It was great.
Happy 5-year anniversary,
yes. Well, thank you so much for watching and for spending quality time with Dr. Brandt and I. We are so happy to be able to share our passion for human movement and purposeful movement with you. If you are interested in learning more or signing up, please book a movement session with me or one of my educators. You can call in or click on this link to sign up right away. And thanks for joining me on this podcast today.
Absolutely. Thanks for having me.